All right, so this is our presentation on rabies, and it's by
Jackson Bennett, Joe Conley,
and me, Americo Scolati. So, for some background info, what is rabies? Rabies is a virus, more specifically in the category of rhabdoviruses. Rhabdoviruses are bullet-shaped, unsegmented, enveloped, and they have single-stranded RNA instead of DNA. Rabies is a disease that is transmitted through the bite of a rabid animal. So, how does this disease develop? Rabies is spread through direct contact with bodily fluids of an infected host, almost always through a bite. Any mammal can be infected with the virus, including humans. Natural antibodies to the virus are exceedingly rare, leading to an almost 100% mortality rate in those infected. Once a healthy mammal is bitten and infected, there are 5 stages to the disease. Number 1 is incubation, number 2 is prodrome, number 3 is the acute neurologic period, number 4 is coma, and number 5 is death. Number 1, incubation. The incubation phase begins immediately after infection, but before symptoms present themselves, and can last anywhere from weeks to months. In this phase, the virus undergoes limited reproduction and spreads from the site of infection into the nervous system through the neuromuscular junctions. Number 2, prodrome. In the prodrome phase, lasting 2 to 4 days in humans, the infected will present with nonspecific symptoms such as fever, headache, and general malaise. Sensations of itching, tingling, coldness, or pain at the site of infection may also occur. These symptoms are caused by your immune response to the virus as it propagates through the nervous system and up into the spinal cord. Number 3, the acute neurologic period. In the acute neurologic period, the rabies virus has passed through the blood-brain barrier and begins to rapidly multiply. Viral load reaches critical levels and begins to damage the brain and spinal cord. Around 2/3 of infected humans will present with furious rabies in this stage, suffering seizures and becoming outwardly aggressive and delirious, while the remaining 1/3 will have paralytic rabies with weakness and paralysis. Furious rabies lasts only for a few days, while paralytic rabies can last for up to a month. Number 4, coma. In this stage of the infection, the damage done to the nervous system by the virus causes the infected person to fall into a coma. At this point, irreparable brain and nerve damage have occurred, which will lead to stage 5, death. Other ways that death can occur due to infection include cardiac arrest, asphyxiation, and dehydration. What are some of the visible symptoms of the disease? For this section, we'll go over the signs and symptoms of rabies in infected animals, as it is important to recognize possible carriers of the disease and avoid them at all costs. The most obvious and immediate visible symptom is foaming at the mouth. This is caused by uncontrollable spasms of the esophagus, preventing the animal from swallowing. Additionally, the salivary glands are producing more than the usual amount of saliva, leading to increased drool or foam. Animals may also be either hyperaggressive towards objects and living things, or they may appear docile and unafraid of humans. The virus has damaged their brain in such a way that impairs their natural survival instincts, as well as their motor functions, which can lead to issues of balancing or walking normally.
prevalence of rabies and risk factors. In humans, rabies is fortunately quite rare. In 2019, there were 14,075 cases of rabies in humans, with 13,743 of those cases resulting in death, which is 95% of all of them. The most common risk factors are living next to areas with lots of wildlife, such as forests, national parks, and frequent contact with animals. Additionally, rabies is much more common in developing countries, as they usually do not distribute rabies vaccines to the local wildlife, as is common in the US as a means of prevention. This likely means that the reported number of cases worldwide is heavily underestimated, as reporting of these deaths in developing countries is very unlikely. The global graph on top shows the numbers of rabies deaths per country, and at the bottom it is reported as deaths per 100,000. How rabies is diagnosed. In humans, rabies is clinically diagnosed through a variety of methods. The first is a two-step process involving either virus isolation from saliva or reverse transcriptase, followed by a PCR test. Serum and spinal fluid may also be tested for the presence of rabies antibodies. And in the final method, a skin sample can be analyzed for rabies antigen and the cutaneous nerves of hair follicles. These methods make sense as they test in the areas that rabies is most prevalent anatomically, namely the spinal cord and other nerves, as well as the infectious saliva.
Anatomical structures that are affected by rabies. Rabies affects the nervous system almost exclusively. It will spread through muscular tissue from the point of infection until it reaches a peripheral nerve, upon which it will travel up the nerve through retrograde action until it reaches the spinal cord and brain. Rabies specifically travels through the axons of these nerves. As previously stated, once rabies has reached the brain, it will begin to multiply rapidly until viral load becomes so great that it damages these tissues due to inflammation and swelling, also known as encephalitis. As a result of this pathway, the location of the infection on the body will greatly determine the length of incubation, with bites far away from the spinal cord taking considerably longer to show symptoms. How rabies is treated. Rabies treatment is almost entirely prevention, as once symptoms begin to show it is already too late for current treatments to do anything. If you are bit by an animal that you suspect to have had rabies, there's a series of shots which can be administered that will prevent the onset of the disease, but these shots must be acquired as quick as possible. In the U.S., the most common way to prevent rabies outbreaks is by concealing an edible vaccine in certain foods and distributing them to local wildlife who are at risk, most commonly raccoons. Additionally, these vaccines are administered to all domestic pets. And here are our references.